Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, I'm so glad you're back with us. So today we're going to be talking about an important topic, sex addiction in teens, which I think is an uncomfortable topic for parents and also a topic that we don't know a lot about, right? So we want some more information. This is going to be such an informative opportunity for you to learn something ahead of time to protect our kids from this and also to recognize it. With that, I will get to Kevin Sims.
Thank you. Thanks for having me.
So this is such an important topic and one that I think does not get a lot of attention.
Yeah, absolutely. I think especially in today's world, this is something we definitely need to be talking about.
Yes,
Especially in my practice, I'm seeing a lot of the effects of this. So yeah, it's kind of near and dear to my heart for sure.
yes. So we're glad you're out there doing the work to
Thank you.
help people. Yes. But we're going to be talking about sex addiction and teens. And I think, it's hard, honestly, for parents to just even talk to their teens or like their preteens, like about sex in general, right? Like there is
Right.
not a lot of conversation going on. So then to talk about something that seems so maybe out of our wheelhouse of like an addiction to something that we don't feel comfortable talking about, eek, right? Like that it's
Right.
hard
Well,
for.
of course. But I love the saying that if we don't talk about it, the internet will.
Oh, yes. Yeah, somebody's
Right.
gonna educate your kids.
That's right.
Yeah.
That's right.
Yes.
Yeah.
Yeah, and I would rather it be me,
Right.
personally in my own house, and I am often the person educating people in my practice, like, to start the conversation, and I think here's the thing I have to say to parents about having conversations about sex is you're never gonna be ready. Like, there's never gonna be a time where you feel ready, and if you feel ready, it's too late.
Right. Absolutely. I agree.
Yeah. So as we jump into this, we're going to put
Yes.
our big kid pants on and we're going to
Yes.
just talk about it. Okay. So tell me to start, can you define what sex addiction is? Because I think this seems like, if we're struggling with that, we don't even know what would qualify as a sex
Right.
addiction and how it differs from like normal sexual development and just curiosity in teens.
Sure. I mean, really, quite simply, for me, sex addiction is an intimacy disorder, right? It's not about sex. It's about using sexual behavior to numb, to escape, to regulate painful emotions.
Mhm.
What makes it an addiction is really the compulsivity, right? So a teen might want to stop, but they just can't.
Mhm.
So healthy curiosity, right, is obviously it's developmentally appropriate. What we're talking about here though is obsession, secrecy, and consequences. I think school performance is going to suffer, relationships are going to suffer, mental health starts to decline, and really it becomes a coping mechanism rather than a connection.
Yeah.
I think, and that's when it really starts to cross the line.
Yeah. And this can be like people can have a sex addiction in person. So like they have this obsession with having sex with people in person. Or can it also be online, like viewing other people? So like pornography?
Oh yeah, the spectrum goes, I mean, in my practice, I see everything from love addiction, I see validation addiction. There's a lot of intrigue addiction, and this comes with both real people, maybe in the workplace, at school, but it also comes with people online, people
Mhm.
that they've really never met before. That, I've had clients that believe that this individual that they're speaking to is, partner. And a lot of times they get caught into sending money and a lot of other, situations and consequences from that type of behavior. So yeah, the spectrum is broad, everything from, love addiction, sex addiction, porn addiction. But that's why I love broken down. At the end of the day, it's an intimacy disorder.
Yeah.
I think
real
that
connection.
it helps understand like how it happens, because I think there's a lot of shame and blame and like parents feeling certain things about their kids being in this place and what maybe hasn't happened, and like, or what this behavior that they're exhibiting, right? And confusion too about like
Right.
what is really going on, like why is this happening?
Yes.
Yeah. Okay, so
Absolutely.
talk about some of the main factors that are you think are contributing to the rise in sex addiction or compulsive behavior around sex, or this intimacy disorder among teenagers today.
Well, we like to joke. It's not joking, but essentially it's like having like a crack pipe in your pocket,
Mm,
right? I mean, we have never lived in a time where kids could access hardcore content in 10 seconds,
yeah.
24/7 without ever being caught.
Mhm.
And the combination of the digital accessibility, the poor emotional literacy, and just really high pressure creates the perfect storm, right?
Mhm.
So add in a little bit of isolation, sprinkle in some trauma, and even emotional unavailability of the parents. And you got a recipe for compulsive behaviors, whether it's porn, sexting, hookup apps, all of it just really used to escape
Mhm.
rather than to feel.
Yeah. Which is really uncomfortable. It's really uncomfortable to feel, right? Especially if you're not
Yeah,
familiar with feeling the real feelings. Like if
that's
what you've
right.
always done is avoid, or your parents have helped you to avoid even, right? Because it's uncomfortable for our kids to be upset. Like,
Of course.
give them something that makes them feel better. Here's a lollipop. Here's a,
Yep.
right? Like, here's a new toy. Here's a show. Here's a whatever.
Yeah. And most kids today, they're exposed to pornography like accidentally as early as ages 8 to like around 11. It's like in my day, we found magazines under plywood in the woods. You know what I mean? It was,
Yeah.
I mean,
It
there's
was, you had to
also,
look a little harder.
yeah, yeah, yeah. And now the access is wild. Plus, without these kind of like emotional tools and regulation skills, they're going to turn to screens, which we know are dopamine hits to self-soothe, right? And it's like you got the secrecy plus the shame cycle. Kids feel shame, so what do? They hide it, and then they cope by what? Going back to the
Mhm.
behavior, right? So it's like, plus that objectification, it's like early and repeated porn essentially trains the brain to see others as objects, not
Mm.
people, right? So it's like this impacts future relationships, even if the kids never develop a full addiction, right? It goes back to that really struggling to connect on a human level.
Yeah. So, I mean, how does that, I guess, how does that happen in the brain? I like the science behind it a little bit to like understand, because it's like we see people, we know they're real people, but if we're
Mhm.
watching pornography, why does that change our understanding of humans?
So essentially, like the early exposure, like rewires the brain. So what it does is it conditions kids to associate arousal with pixels, not people, and
Mm,
essentially intensity over intimacy. And it also creates these like unrealistic expectations
mhm.
around sex and bodies, reinforces objectification, and essentially just erodes the capacity for like a genuine connection.
Yeah. Which
Yeah.
is really what sex is made for, a genuine connection, right?
Ex-
Like
right.
that's
It's
it.
unheard of now to talk about it like that, right? Like
Yeah.
real love and connection and sharing between two people that love each other, right?
Yeah.
It's, yeah.
Well, and I
And,
think that's probably what they're really looking for, right? I mean, maybe not at that age, right? When you're little, that's you're just looking for connection from
right,
other people, peers,
right,
parents, teachers, right? Like in healthy, normal, non-sexual ways. And then as you develop into an adolescent, then that becomes an idea that you have,
right,
right? Is that
right,
you're looking for this intimate connection that includes sexuality. And so, I mean, it's normal to explore that. It's normal for
course.
teens to be curious about their bodies, about other people's bodies in a way
Sure.
that's, let's say, consensual, right? That
Right.
is like mutually shared and is in real life.
Yes. And then you tack on, social media,
Mhm.
and that makes it worse around like validation kind of becomes currency and teens start performing instead of really relating.
Mhm. Yeah, and then I think they maybe don't know how to do that, right? It all becomes a performance, right?
That's
Like
right.
I'm dating this person and that's a performance. It's
Right.
not about like whether I really like them or not. My friends like them or other people like them. And
Yes.
so then who cares
Right.
what I think? It's this validation that everybody's like, "Oh my gosh, you're dating them? That's
Right.
amazing."
Yes. And not to put my age out there, but in my day, the validation hit was the will you go out with me circle yes or no.
Yeah.
Right. I realize now at 46 years old, those were my first dopamine hits.
Mhm.
I'm clean and sober 17 years off drugs and alcohol, but essentially that dopamine hit was my first addiction, hands down. I
Yeah.
could tell you every girl that I had a crush on from kindergarten on.
Mm.
Couldn't tell you my teachers' names, but I can tell you, which girls it was. So,
Mhm.
not that's on such a small scale compared to like what we're discussing now.
Yeah. Well, and I think I mean, dopamine, yeah. I mean, a lot of people, we are struggling with addiction of dopamine, right? But it's a chemical that's in our body that we
Right.
can, let's say, artificially or easily produce within ourselves. Like it's
Right.
when we have to work for dopamine. I mean, the idea behind dopamine is it's a reward center, right? It is giving us that, like, yay, you did it. You did a really good job. You worked hard
Hmm.
to get this. But when we can get dopamine basically for free and there's no work associated with it, I mean, it's hard to not keep hitting the lever, right?
Of
Whatever that
course.
lever is, it's hard to not keep going back because all you have to do is pick up your phone or, sometimes like sugar can be a dopamine thing, right? Like eat the thing, it's whatever. It creates that really good feeling right away. And then we
Right.
wonder why our kids are so resistant to like tolerating distress.
Right. Make a post and now all of a sudden I'm getting some validation and,
Mhm.
feeling better about myself for sure.
Yeah. And really it's about connection. And even when I think about like times where I'm upset, like the thing I want because I was able to develop healthily around this is connection. Like I want
Hmm.
somebody to say like you're going to be okay or give me a hug. It's that physical piece of like being there, still validating, right? Like you're going to be
Hmm.
okay, but it's about me personally in that moment, right? And it's a real person giving that versus it being a post where I'm like, I'm having a really sad day and then, no one likes it and then I'm like even worse off or I get that validation where everybody is like, "Oh, it's okay, whatever," but it's not that real connection. Do you feel like we're missing
Right.
a lot of that?
I do, and I'm really grateful for people like Patrick and Stephanie Carnes that when they developed the CSAT, they really teach us that the antidote to shame is empathy, right? So as therapists, we kind of come with a little new school two-person psychology model where we're in this together, right?
Mhm.
So when people come in, we're really building that connection,
Yeah.
rapport, or even taught sometimes to tell personal stories,
Mhm.
to really take away that shame
Mhm.
that people are coming in with so that we can form that real connection,
Yeah.
which is why also a lot of the meetings, that the 12-step meetings that people go to are men, all men's meetings, all women's meetings, really, with men, learn how to connect with other men, learn how to be intimate with other men, start open up, share, so that you can kind of transfer that over into, dating and love and relationships.
Yeah. Yeah.
Yeah.
That's interesting. I hadn't thought about it in that way of like why they do gender specific of like it's
Mhm.
more safe because you're more like there's nobody to impress maybe or
That
less
too.
people to impress, right?
Yeah,
And
that
so
too.
Yeah.
Right.
But I think that makes sense of like practice it here, right? To translate it over, which is also what we do in therapy too, right? Is we teach our patients or clients how to do certain behaviors of revealing things and then being warm and accepting, right?
Yes.
And so it's like if they've never had that, having that connection, I mean, is such a valuable thing that our clients give us, right? Like to
Yes.
allow us to be present in their lives and hear real things that are happening and allow us to bear witness to that.
Right.
Yeah. Okay. So we're hearing that, early access to pornography and social media, all the digital content that we can get, impacts healthy sexual patterns or can cause unhealthy ones.
Mhm.
So, I mean, what should our thought around we probably can't keep our teens off of social media completely. I mean, it isolates them
No.
from peers and I think it's more about how you manage it. But like,
Right.
what can we do to like, how do we have these conversations? I think, how do we help our teens in this space? I think it's hard for me to get out the question because there's so many
Yeah.
pieces to it, but
There's no foolproof way of doing this, but when we have the knowledge of what this is doing, I think we can start to mitigate the severity of some of this stuff, right? I mean,
Mhm.
we know that essentially it's like developmental hijacking, right?
Yeah.
Kids exposed to porn before like emotional maturity had their sexual template formed by media, not like a healthy connection. So really it's going to be kind of around knowing the age and where your kids at are as far as on a maturity level, right? There's also like the emotional detachment that comes along with it, where like early porn kind of teaching this detachment from
Mhm.
feelings, right? Sex becomes performance, right? Not intimacy,
Yeah.
right? So again, here we are talking about the performance, the objectification, right? Like viewing others as a tool for pleasure, right?
Mhm.
It really warps that empathy, and really sets the stage for like a lot of like relational dysfunction. And you asked about the brain. It's neurochemical bonding, right? The repetition of screen based stimulation, it just conditions dopamine dependency, creating compulsive behaviors
Mhm.
disconnected from any like real kind of human interactions.
Yeah. Well, and it seems like it would also be somewhat easier, like, not to get too graphic, but, like, I mean, when you're with an actual partner, you've got to work for the pleasure, right?
Right,
Like, there
right.
is a process happening, and if you come ready and your partner's not, you've gotta, like, work that up, right? Like, you've
That's
gotta
right.
get them to the same places you are, but in pornography, there isn't another side. There isn't
No.
another person, like, so it's just about you. Do you find that impacts relationships too, where
Oh
it's like
man.
one-sided versus being thoughtful
Yeah.
about the other person's enjoyment?
Absolutely. There's always kind of been this thinking around like with a lot of like sex addiction and partners that cheat, or where there's that narcissistic trait of this
Mhm.
very selfish, self-seeking type of behavior, right? I hear a lot, sadly, from people that come in and, well, only if they gave me more I wouldn't do this, or
Mhm.
right? Not realizing just how narcissistic and selfish that sounds, right? That this
Yeah.
is a partnership, right?
Mhm.
It's not about that, right? And you're absolutely spot on. And when you're watching something like this, you don't, especially as a child, you don't know the ins and outs. You don't understand the complexities around this until you're in that situation. But if you're coming at it from a performance
Mhm.
standpoint rather than a real connection, caring, intimate situation, right out the gate, you've already kind of missed the mark essentially.
Yeah. Well, and then it's also you don't know what that's like, and so you may give up and think you're failing, right? And so then
Hmm.
relationships may end unnecessarily because you don't even have an accurate picture of like what this process might look like, right? That
Mhm.
pornography is a totally different demonstration of what that looks like than what it would look like in real life.
Right. And a lot of people aren't even getting to experience that real life because they're
Mhm.
just so caught up in and that the idea of why even bother when I have this?
Yeah.
What's I want when I'm gonna get rejected or I'm gonna have to,
Mhm.
put myself out there. So there's a lot of layers to it. It's not, you really see the effects of
Mhm.
friendships and, just any type of close connection with family. And I think parents need to kind of look out for that. If you're, it's like when, parents were told if, when kids are potentially using substances, you ask them, have they stopped playing sports? Have they
Mhm.
stopped hanging with their old friends?
Mhm.
Very, very similar type of situation. If they, oh, I don't want to play soccer anymore. Now they're in their room, for 3 hours, like, oh, what's, really checking in on what's going on.
Mhm. Yeah. So, I mean, that's a great thing to talk about. So, like, what signs should parents be looking for? And that, I mean, that might, because it's like if you ask, I mean, sometimes if you're asking somebody who's using drugs, like, hey, are you using substances? Right? Like, they might tell you, but like,
Mm.
if you ask your teenager, like, are you watching pornography? I feel like the answer, I mean, I don't know, but as
Is
from a
no.
like, it's gonna be
No,
no. Like,
no.
that feels
You
like
ask an adult
100%.
if you ask adults if they're watching pornography, the answer is going to be no. It
Yeah.
was so you're going to look for that secrecy, but you're also going to look for things you might not necessarily think of, like mood swings, the social withdrawal I was talking about. You also want to look for anxiety, depression. You're going to look for like declining performance in school or sports. You also might see that loss of interest in like the age appropriate type of relationships, right? Or like obsession with like
Mhm.
different types of sexualized media. It also sometimes shows up in aggression, definitely like low self worth or compulsive phone use. I always tell parents, like, trust your gut. If something feels off, like don't ignore it.
Yeah. When it's hard because like I mean, this is if as adults there is like a discomfort with this topic, um, it's hard to just imagine talking to your kid about it, but then also you can't not, and you don't want this to become something that takes over their entire life, right? Like we know that early intervention for all things is better.
Right.
And so it's like, if you feel suspicious of something, like something's just not quite right, I can't quite put my finger on it, right? Then
Mhm.
what do we do? So we are like, okay, they're withdrawing. They're not being themselves. What do we do as parents in that situation?
I mean, depending on kind of the situation, you want to limit or take away, privileges or use. There's, blockers you can use,
Mhm.
um, or a lot of times parents will kind of, I wouldn't say like use me to have that conversation, but simply put, right? I'm tattooed. Kids are like, oh, this guy, this won't be as judgmental as dad over here.
Mhm.
So just, we remember being kids, your parents are the uncoolest adults,
Sure. Yes.
right? So
Yeah.
kind of like, I hate to say it, but almost sometimes any other adult, it's easier to kind of have
Mhm.
that conversation and get the kid to talk, especially, like we said, like we're taught, where I'll say, hey, when I was your age, I used to watch this, and you can tell immediately by
Mhm.
speaking that language of the heart
Mhm.
that they know exactly what you're talking about,
Yeah.
right? So, don't be afraid to ask for help. That's all I'm
Yeah.
going to say. Don't be afraid to ask
Mhm.
for help. You know, Sending your kid to talk to someone that specializes in sex addiction, you don't have to even say anything about that. Just it could be a couple sessions to just kind of suss out what's really going on.
Yeah. Well, and I think, something that helps me talking to the teens that I work with, because like if I'm like, have you been sexually active? A lot of them are going to be like, no, right? Like, I mean, sometimes they're
I
not
hate
even
that.
sure what that means, right?
Yeah, that's right.
So So it's like, I normally say, and I got this from a pediatrician I really adore, and her question to the teens that she sees is, tell me about your love life.
Right.
Right. So
I
it's
love that.
not, not getting quite to the heart of it, but it's like, you're kind of opening the conversation, but it doesn't shut them down right away, because it's like, you could be dating somebody, you could, right? And then what does that look like? Tell me more. Right. Like, and so then you can kind of do that. I wonder. And to be honest, I talk about pornography in my practice, but I just like name it. But normally I do things like, tell me how often you watch pornography.
Yeah, or I'll go, what do you use? Pornhub? Like I'll name things so they know that I know what I'm talking about. And I get them to laugh too, because I want to make it a little easy. I'll say like, oh, you look like you got Riz. Like what girls are you hooking up? But and they just kind of laugh and they're like, oh yeah, there's this one girl that I'm kind of, try to act cool. Yeah. And then now I get it flowing. Right. So it's and then just playing dumb even, like, oh, what's the type of stuff you guys are, acting like I'm like the uncool adult sometimes. Or get them laughing.
The website, right?
You're right. Yeah.
And then so I think, it's not that we're trying to manipulate, but I think it's that they know the things to say to shut down, right? Like this, like I'm not supposed to say yes to watching pornography, even if that is what I'm doing. And so like, you don't want me to say that as my parent. And so I'm going to say no, but also I don't want to have that conversation. But, having an aunt or an uncle or, a really close family friend or somebody that could have that conversation to kind of open the door to see, is there something going on here? Okay. So let's talk about, like, is watching pornography in general, let's say for a teenager, we're going to say 13 plus, right? Is that healthy, unhealthy? So if we're not getting early exposure, right? Like the parents want to know, like, should we be saying absolutely no is our goal, but where are we at?
That is such a tough question, right? Because of what I do, obviously my thoughts around it are a little bit different, right?
Mm-hmm.
I'm going to say that because of what's out there now, and because of the exploitive nature in it, and because of just the trauma around, because of all the factors that have to do with like even making a video and the people that are involved, I'm going to say it's unhealthy.
Yeah.
Now, but I'm a realist.
Mm-hmm.
So I understand that kids are going to watch it, right? So at 13, right, it's the problem with it, I think, is that when it gets too extreme and the arousal template has gone to a place that's dark.
Yeah.
Right? Quite frankly.
Mm-hmm.
And you can't, it's the saying, like, certain things can't be unseen. And that's true. And it's so sad that nowadays, literally violent stuff, just really normalization of aggression, and that type of pornography. It's not like the magazines that I had under the piece of plywood where there wasn't anything hardcore, right? It's like, it's very different. So, I just always stress to parents, like, hey, look at their search history, look, and again, same thing. I'll ask kids like, oh, what I'll even ask straight out those questions, like, what type of stuff are you watching? Even the anime stuff, I've had clients that are full on addicted to anime pornography, right? So it's like, you think, oh, it's cartoons. No, I've seen it, have a really negative impact on marriages. So from my lens, sure, I'm gonna say it's for most people, it's just not healthy. But from a realistic standpoint, everyone's gonna check it out and watch it. So really having a close eye on it.
Sure. Yeah. Well, and I think, it's also just like thinking about like things like people talking about, like, you look at women enjoyment, like how women look in pornography, and they don't necessarily look like they're enjoying it. Or if you talk to a woman who has had sex, they're like, that's not like, that doesn't sound good to me. Like
Right.
that's not what I want. And so then it's, I think that can skew the lens of what positive things can come out of that, how much connection, how much mutual appreciation. And I mean, because the truth is, we also have research that says having orgasms is great, right? Like it
That's right.
helps be more productive at work, helps us to have more positive feelings within our relationships when it's done within a relationship, right? In a healthy, productive way. And
Right.
the definition of healthy is what that person's willing, like interested in doing. We can't define that, but I think that's good, but it's also this confusing part of like, it feels good, so why shouldn't I do it?
Right. And that, yeah, healthy exploration, healthy masturbation, 100%.
Yeah.
It's when things start to, cross that line and, 3 times a day, there's inflicting pain, there's when it starts to be really problematic and,
Yeah.
you're
You
having
can have the rest of your
consequences.
time.
Absolutely.
Yeah, that makes sense. Okay, so how do you think it impacts boundaries then that teens have around sex if they're watching pornography early, and also impacting their self-worth? Like you kind of hinted at,
Oh
like
my
taking
gosh.
risks of like they could reject me, and like, but that's part of the process, like the resilience to get back up,
That's
like
right.
but yes,
Right.
sorry, I'm
Yeah. I
answering your
mean,
question.
no, yeah, it's like with technology, we have so many, right? Yeah, you used to have to ask someone for their phone number and
Yeah.
memorize it and go home and call it and ask them on
Mhm.
a date. There was no term as ghosting, right? Or any of that, right? If you had the nerve to get a number, call, you were probably going out. Right now, we have this other extreme too of like the pickup artist and the red pill culture movement and all that, which is the other extreme to that,
Mhm.
right? But there's a healthy way to talk to people at, really kind of just be pleasant. And absolutely it can crush self-esteem, right? And hijack
Mhm.
the identity. It's like many teens really start feeling like broken, ashamed, or even like disgusted with themselves. It's hard to build authentic relationships when you're hiding, when sex becomes something that's like transactional or
Mhm.
performative, right? Boundaries get like really blurred or honestly non-existent, and a lot of kids just become disconnected from their bodies, from trust and from intimacy,
Mhm.
and I brought up kind of just the impact of like violence and BDSM porn on youth is just, BDSM and any type of like violent porn without consent. Um, it teaches really like young viewers through this like that dominance or degradation or pain
Mhm.
equals arousal or love,
Yeah.
which isn't the case, right? It's like two consenting adults that want to experience something, and then of course there's that shame and fear cycle where many fetishes are like rooted in fear, secrecy, or trauma. So that gets fused with pleasure,
Mhm.
causing confusion and shame,
Yeah.
essentially. So yeah.
Yeah. So how do we talk to kids about like healthy relationships? Like how do we, so if the fear is, I mean, pornography's out there. We do our best to guard our kids against especially early access, but having access to pornography, right? But how do we then, I mean, is there a value in talking about healthy relationships or talking about what relationships ideally look like or how they feel?
Oh, absolutely. I think that's extremely important because I mean, we talked about earlier, isn't that what essentially like we're all looking for is that connection,
Yes.
right? And it just gets very confusing because so much of the connection is via screen, whether you're on a Zoom call or you're on so really being able to have that dialogue with your kids about what it looks like to have like a real connection, and take someone roller skating, and go to the movies, and
Mhm.
it's not corny and cheesy. It's just like real connection, and building those really strong relationships.
Yeah. Well, and I often find that parents don't like when their kid is ready to date, right? Whenever that is, like they don't really talk about healthy relationships or like what does your kid think is a healthy relationship or what are they looking for? And they just kind of let them out into the wilds, right? Per se.
Right.
And I think it's because it's awkward and uncomfortable. It feels weird to say maybe those things, or maybe our parents didn't do that to talk about that. And so then the only thing that our kids have is us as a model, right? Whatever our
Mhm.
relationships look like as adults in their life. And then also, other adults maybe, and then what it looks like online,
Right.
which
Yeah.
I mean, sometimes we're really good models for our kids, but maybe we're not always the best models for our
Mhm.
kids, right? Like, and so being conscious of that. So like if we don't want them to um, create our relationships, or we've been in unhealthy relationships, or we know what that feels like, and then you can imagine what's online where people only post the highlight reel. There's not real life happening on those reels. People would be so bored by mine. I'd be like, I did laundry today,
Right,
yay.
right,
I
yeah,
Yes,
right.
I washed my dog, yay, this is so great. They'd be like, yes, I'd have 0 followers. But I think, when it's that way, it's uncomfortable to say, but I think our kids have a lot of information, but they also have a lot of questions and they want somebody to answer them for them.
I couldn't agree more. And it's those discussions are so helpful,
Mhm.
and to be probably just a little more transparent than sometimes you think is like comfortable, right?
Mhm.
Like to be able to say like, mom and dad this, or when we met, we used to go and do this, what a kids you're at, because it has changed,
Sure.
right? It's times have changed. We're not, out riding our bicycles to the street lights come on type stuff, right? I mean,
Sure.
in a lot of neighborhoods. So things have changed, and we have to kind of, understand and relate to that. But there still has to be that dialogue and
Mhm.
and and connection.
Yeah, and I think young, we can start talking about dating
Young,
when kids are really little. Like I talk to I mean, I have a 13-year-old and then an 8-year-old and 2 other kids too, which we haven't started talking about dating, but at 8, 7, 8, I mean, we start talking about like dating. Like, when do you think somebody would kiss somebody? Like,
yeah,
right? Because they're like, it's funny. Recently, my daughter has had a transition. She is 8, almost 9, and she has had a transition from like, oh my gosh, covering her eyes when people are kissing on a show to being like, huh, right? Like, and I'm like, that's totally normal. Like to be like, not disgusted, but curious, right? And
right.
so when I noticed that happen, I was like, hey, I noticed that you weren't feeling as shy around that. That's totally normal. And I
Yeah, I
just
remember.
said, right?
Yeah,
And then I went
yeah,
back and had more conversations, but it was like just to say like that's like your body's doing exactly what it's supposed to.
yeah. My mom taught me how to skate backwards in the basement so that when I went to the roller skating rink, I could do the couple skate and skate
Yeah.
backwards. But so it was like little things like that where, she essentially was saying, hey, get a girl, skate, and now you're going to be able to be one of the guys when they call out the couple skates that can go out there and not be afraid because you know how to skate backwards,
Yeah.
right? And that was really helpful. It sometimes, there's a really fine line between like talking and and pushing,
Sure.
right? Depending on, but when you know your kids, and when they're still at the phase, or when they're starting to, and that would be the time to go, hey, and teach you how to skate backwards, because it's
Yes. Yeah.
yeah,
Yeah.
absolutely, yeah, yeah.
Yeah, and I think it's, like talking about like what do you think about holding a girl's hand or a boy's hand, or
Mhm.
and what does that mean for you, or how would you know if you're ready to do that, or like, it's okay to have crushes, and like like who do you think is cute, right? Like just
Right.
all of those parts of like, this is totally exactly what your body is supposed to do. Like this
Yes.
is so expected. And then they feel like, okay, this isn't weird, right? Like I'm normal, right? Like that's what kids want so bad, is just to be like everybody else and to say like, your body's doing this exact thing exactly the right way. I think helps kids. And then talking about love and what that feels like. And I think also talking about heartache, which is hard for us, because I think, you know, as parents, my parents said, you can't date until you're 16. That didn't work exactly. When I was 15, I decided I was, you know, had a friend I was not dating, and they would ask me, are you dating him? No, we're not dating. We're just friends who kiss.
Mhm.
Right. So, but,
Right.
you know, it's like I think we have choices of, we either keep things above ground by having conversations, being open, being a parent that is somebody that our kids can talk to, or they're going to take it underground.
That's
And
right.
that's where things get dangerous, right? Is when they're trying to figure out how to manipulate things around us, keep things secret. Like you talked about earlier about secrecy, that's where a lot of trouble lives, right? If it's something you can't talk about, we're probably doing something we shouldn't be doing.
Right. Exactly.
Yeah. But hard. So, yes, talk to your kids about healthy relationships and what they think is healthy, right? Because what
Yeah.
we think is healthy might be different than what they think, and getting curious about that.
I mean, all kids are different. You know, their school environments are different depending on where you live in the country. It's different, right? It all depends on kind of where they're at.
Yeah. Is there anything else that you feel like parents can do to prevent an addiction to sex or pornography?
I mean, it's really just, again, like normalizing the conversation, you know,
Mhm.
start early, talk about bodies, talk about boundaries, you know, feelings that are coming up in like age appropriate ways. Um, I remember when my mom caught me with one of those magazines, you know, and she just explained to me that, you know, there's no shame around the human body.
Mhm.
What was wrong was the sneaky, lying way that I was looking at it,
Mhm.
right? And, I always say kinda too, like, de-shame curiosity.
Yeah.
Curiosity is normal,
Mhm.
right? Like, demonizing sexuality or bodies just increases, you know, the odds of secret compulsive behavior.
Yeah.
Um, talked about, you know, model healthy relationships. You know, kids learn more from how you live than what you say,
Yeah.
right? They pick up on everything. So really being able to show emotional regulation, respect, and vulnerability. Like,
Mhm.
you know, that's, my dad would think that's like new age stuff, but like, no, you got to show that vulnerability, and then really just like creating a safe home for honesty,
Yeah.
right? Like, honesty should never be penalized, right? Make sure the kids know that even if they screw up, even if they get into something scary online, that you're a safe landing place, you know, not a punishment
Yeah.
machine, right?
Yeah.
Yeah.
Yeah. To figure
Because
it
if,
out
yeah,
collaboratively. Yeah. Work
totally. If kids are afraid of your reaction, they're gonna hide what they're struggling with, you
Mhm.
know, and hiding is what addiction just thrives on,
Yes.
right? That's why you know, all the sex addiction books are called like Out of the Shadows and Living in the Shadows, because it's that type of
Mhm.
like living in the
Yeah.
shadows behavior, you
Yeah.
know. So yeah,
Yeah. Well, this has been a very helpful conversation. Thank you so much, Kevin, for all
absolutely.
of
Thank you.
your wisdom and help on this very challenging topic.
Absolutely. Thank you so much for having me. It's been an absolute honor.
Thanks, Kevin, for being such an expert in your field and coming to share your knowledge with us. We so appreciate it. With that, I will say thank you so much for your time today. If this episode was meaningful to you and you feel like other people you know could benefit from it, will you share it with them? Will you also take a moment to subscribe to our show on the platform that you listen to? We'd also love it if you follow us on Facebook, Instagram, TikTok, and YouTube. And guys, we love the emails with topic suggestions for future shows. If you'll keep those coming to accidentalexperts@gmail.com. Have an amazing day.
some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.